We're back. I'm Tina, and Larry is talking about the insurance thing, and our wonderful Tony is actually asking some questions here when we went to the break. Tony, ask that question again, because that was really important about the Medicaid and the cost.
My concern, Larry, is that we have this public mandate. We're going to be forced to purchase insurance, and yet they're going to increase under the bill the eligibility under Medicaid for people that can be covered. The problem with that is we know that if you look at Medicaid, you've got 20% that's going to essentially leave in administrative costs. That's about 10% more than what it costs now to have it administered by private insurance groups. And yet we are increasing the rolls. We are going to create an enormous amount of burden for the states in order to pay for this. And in fact, Texas, the Attorney General today indicated that he believes that it's going, over 10 years, going to increase $20 billion worth of
For one state?
For one state, $20 billion worth of increases in Medicaid costs. You alluded earlier, Larry, that we're going to have to increase taxes. The other option is we're going to have to cut services.
Which do you see happening?
Both.
Both, of course. What am I talking about?
And there's more to that. There's going to be defer. Gee, I'm sorry, you're too old. Or there's going to be a large waiting period. If we need an MRI this week, we could have an MRI this week.
Sarah Palin's death panels really weren't too far off target? Come on, Larry, speak up there.
The National Association of Health Underwriters doesn't know anything about death panels, okay? But what we do know is that it makes logical sense that defer, deny, and just overall cut benefits.
So you're rationing care.
Rationing care.
That wouldn't happen. Oh, did they lie? I am shocked. God, I'm so surprised. Did they lie?
Well, let's talk about the candy part of this healthcare reform and some of the easy things that were addressed. And some of those easy things were mandating that all health insurance plans, group or individual, will have to cover routine physicals, mammograms, pap smears, and PSA testing, and so forth.
What if you don't want one? They're going to make you go get one?
No, but it would be at no charge. So you're going to pay for it whether you use it or not.
I see.
Mm-hmm. So, you know, I have an idea, and this is my own personal thoughts, but if they can mandate that a person has to buy health insurance, why can't they mandate that everybody has to get healthier or do a little something towards their health?
So Larry, the fellow that goes out and drinks a gallon of wine each night and smokes a cigarette gets thrown into the same pool as the guy that's out jogging and who is eating tofu and drinking water.
And that guy always falls before the other guy. That's all there is to that story.
They're all going to be thrown in the same pool then, Larry?
Well, after all, there are more old drunks than there are old doctors. So, yeah, unfortunately. Now, see, the way that it has been up until yesterday is that healthy people are rewarded in their premiums in that a smoker does pay more. If a person is taking 2 medications or more.
That's fair.
But, yeah. But what about the individual that has a pre-existing condition because he drinks his gallon of wine at night and smokes and now comes to the table with all kinds of health issues?
Well, if he's had health insurance, there was never a problem. As long as he's always had health insurance in place, the hospitals, the doctors, they're going to take care of him. He has health care.
But what if he doesn't have health care? Now he gets added with all his pre-existing conditions and thrown into the pool, creating all of the increase in premiums for the rest of us?
Initially, they are talking about putting in a national high-risk pool, which is, there's 32 states have high-risk pools. And they are a great mechanism for people that have pre-existing conditions to get health insurance. And granted, the premiums are higher, but it's a guaranteed issue program.
This is a huge bowl of spaghetti, and it's all just snarled, and it's all just like that, and it's just a mess.
It is.
It is a mess.
And
it's just getting started. Give it some time.
Right. Well, I think that it's not a bad idea that we allow people to get into the pool, okay? Be it a high-risk pool just like the 19-year-old kid that has 22 speeding tickets and it's mandated that he has to have automobile insurance. Thank goodness this kid has automobile insurance, and granted he pays more and the benefits may be a little bit reduced. So a person that has blatant disregard for their own health, they now want to buy insurance. They should be able to do that.
That is the American.
It is. But whether that full-blown policy goes into effect on day one, I personally have questions with. If there's a 90-day waiting period, we'll take care of a slip fall if they break their leg tomorrow, but if they've had blatant disregard for their health, then they should have at least a 90-day waiting period before the insurance kicks in.
What is the average person? What do you think the average person is going to be paying for insurance?
It depends on the state. Just like your health, just like your automobile insurance.
The state is going to have something to do with this? I thought the federal government was forcing this.
No, it's still state specific.
So the state is going to tell you how much you have to, what kind of insurance, and they said that the IRS can say, they can check what kind of insurance you have, and if they don't like it, then they can say, oh, you don't have the right type. So, but what do you think the average cost is going to be? Is it going to be like $200 now, or is it going to be $500, or how much is it going to be for someone to have insurance now?
You know, if you look at what it costs in New Jersey and you cross the bridge and you go into Pennsylvania, for a 30-year-old male, single, non-smoking person, the price difference between those two identical plan designs is in excess of a $500 swing.
A month?
Yes.
Yeah,
because
dirty.
of the mandates that they have in New Jersey that they don't have. So mandates are the enemy, okay?
Well, governments.
There are no bad mandates. The problem with mandates is what they cost.
Right.
Okay? It's nice to cover everything, but boy howdy, infertility is very expensive.
That is something, that is just, okay.
And if
We're
we
going to
need-
have to talk about that, but you know, we're coming up on a break, and I see that the phone is blinking, which means that Robert Godet is with us, and we're going to talk to him in the next segment. He is the Tea Party guy, and I'm sure he's going to have something to say about what just happened, because the Tea Party folks aren't happy. No, 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 they're not happy. So we're going to take a break, and we will be back, and we'll be speaking to Robert via the phone. Be right back.